You've landed at the edge of what medicine has known and what it's becoming. I'm Dr. Richard Rocker, and this is the Integrative Continuum, a podcast bridging biology, energy, and human potential. In each episode, we explore how quantum biology, frequency medicine, and ancient healing systems are transforming our understanding of health. This is where mitochondria meet meaning and blood work meets bioenergetics. Subscribe now and join me on the frontier of integrative healing, where science and soul are no longer separate. Welcome to the Integrative Continuum Podcast. I'm Dr. Richard Rocker. This is where we explore health, healing, and performance through a truly integrative lens, looking beyond symptoms into the deeper biological, environmental, and lifestyle factors that shape well-being. Most of our conversations here focus on human health, but today's episode takes a slightly different and very important direction, because for many of us, health doesn't stop with ourselves. It extends to our pets, our animals, and the companions that share our homes, our routines, and very often our emotional lives. Whether you have a dog, a cat, a horse, or other animal you deeply care about, pets have increasingly become part of the family. And that naturally raises an important question. Do the same health principles that apply to humans also apply to animals? Do nutrition, toxins, gut health, immune balance, and environmental stressors influence their health in similar ways? Today, we're exploring exactly that and how integrative and functional principles can transform the way we think about animal health, prevention, and longevity. Today, I'm delighted to welcome Dr. Marlene Siegel, a true pioneer in veterinary medicine with over 40 years of clinical experience and more than 2 decades dedicated to integrative and bioregulatory approaches to animal health. Dr. Siegel has uniquely blended traditional veterinary medicine with cutting-edge therapies such as ozone therapy, photodynamic therapy, detoxification strategies, and bioregulatory medicine, helping both pet parents and veterinarians move beyond symptom suppression toward addressing root causes. Her work spans holistic nutrition, online education, practitioner training, and the development of the upcoming SPAWS, that's SPAWS, Family Wellness Centers, designed to support not only pets, but the families they live with. In today's conversation, we'll explore how functional and integrative principles in animal care can inform, challenge, and even inspire the way we think about health, not just for animals, but for ourselves as well. Dr. Siegel, welcome to the Integrative Continuum Podcast.
Thanks, Doc. It's an honor to be here, and it really so exciting to hear somebody else read that bio. It was very impressive how much we are going to get done today.
Excellent. Well, let's dive right into it. Really looking forward to this. So you've spent over 40 years in veterinary medicine with a significant shift into integrative approaches about halfway through your career. So what was missing for you in conventional veterinary practice that pushed you to look a little bit deeper?
Well, like most of us, there's some life-altering experience. It's usually your own health or the health of somebody that you love that drives you in a different direction. And for me, it was a riding accident with my youngest daughter and one of my show horses. And the horse literally saved my daughter's life. Afterwards, in my quest to fix the horse, I was told by equine veterinarians, I do small animal work, and they said, "We're sorry, we don't know exactly what's wrong with Lily the horse, but she's not safe to ride. You'll never show her again. You can put her out to a pasture or you can put her down." And it was those words, there's nothing more that can be done, that triggered something in me. And I was absolutely determined I was going to find an answer and no one was going to tell me otherwise. So that's really where my pivot became. And so I started looking for things that I could use on Lily to help her heal. We discovered that she had arthritis in her neck from her teeth not being floated properly. So horses' teeth grow all the time. And she had little points in the back of her teeth that had grown. And even though she was supposed to be getting her teeth done appropriately, obviously it wasn't for years. And so every time she was asked to bend her neck, it means that she has to bend at the pole in the back of her spine, and she couldn't do it. So she was having to strain her entire neck for years in order to put herself into this position and to be able to carry her weight appropriately. So after a point of time, she started to have spasms and they got worse and worse. Well, I was going to find a solution. And that took me into chiropractic work, acupuncture. Then I started looking into nutrition and herbs and supplements and how to reduce inflammation. It took me to the woo woo side because I started learning energy medicine. And everything I learned to treat for Lily, I took into my small animal practice and my own personal life. So that was the impetus for the change. And then I've not stopped changing since. So it's been over 25 years now, and I'm always seeking more answers because my promise to myself, to my clients, to the people that I served and their pets that they love is that I would never utter those words. There's nothing more that can be done. And Doc, if you're going to make that kind of a commitment, you have to have a big toolkit to back it up. So it wasn't enough to have steroids, antibiotics, surgery. That just wasn't going to hack it. I needed to really understand biology. And as I opened myself to that exploration, the most amazing teachers and guides came into my life and really took me to a level that I would never in a million years have anticipated I would ever go. And here I am. So it's a great journey.
Fantastic. So, yeah, I suppose just with veterinary medicine and, human medicine, veterinary medicine, sometimes there can be a little bit of a tension there, especially between conventional training and integrative approaches. So, how did you navigate that transition without kind of losing any kind of clinical rigor or credibility?
That's a great question. Trust and faith. In the beginning, when I would have that patient that I knew what the right thing was, in the beginning, I was a little tentative. I was going to offer it to the client, but almost apologetically. And inevitably, every single client goes, "Oh, I love that. I take my children to an integrative doctor," so as the more I did it, the more I started to trust. And now I just have that level of confidence to know that I'm going to pick the right tool for the right situation. And sometimes I dip into my Western toolkit, but most oftentimes it's a combination of my Western and Eastern mindset that comes together for the best patient outcomes. And because I document everything, I now have a plethora of case studies from beginning to end, which you can't deny the truth, right? Once it's on video, it's real. You can't make it up. And so it's not my word that something happened. I can actually show my clients proof. And because of that, a lot of the companies that I use their equipment actually have me do presentations for them because they want the human doctors to see what's possible in the animal world, no placebo. And that way they can start having more confidence using it in the human world. And I think it's just a paradigm shift. We have to look at the world that we're in. It is such a challenging, toxic world, at least in the US. Right now, cancer rates in dogs are 1 out of 1.65. That's almost 100% of dogs having cancer. Well, if Western medicine was all that perfect, we wouldn't have cancer rates that are this high. So obviously it's that time to be introspective and to look at what we're doing in our world in the way of nutritional deficiencies and toxicities and start making a change. And we just have to start changing our lifestyle. We have to change the way we show up on this planet if we want to have a different outcome.
I agree 100%. I always say, well, if we were really so smart and advanced as we believe we are, well, shouldn't obesity rates, shouldn't cancer rates, shouldn't metabolic diseases all be going down? And they don't seem to be going down. They've been going up and up for decades and decades. So logic would dictate that, hey, something we're doing is not working, right?
That did not take rocket science, right?
No.
Einstein was so ahead of his time when he said, you can't solve the problem of the world with the same mindset that created it. Well, we've been sold on fast, cheap, and convenient. And now we're paying a master price for that as we're destroying Mother Earth and we're destroying our health and our pets' health. So I see many, many people, especially after COVID, starting to really, the term wake up, where they're
Mhm.
starting to have more consciousness. They're starting to pay attention to the things that they're being told and they're questioning the logic. We've lost our critical thinking skills and it's coming back. So I think that's all been a really positive thing because at the end of the day, if we don't change our behavior, nothing is going to get better. So people that are starting to, instead of pointing their finger away, they're starting to look inside themselves and saying, what can I do differently? How can I think differently? How can I behave differently? How can I support every part of my pet's body, my body, in a way that is actually sustainable for themselves and the planet? And I think we are making a big movement. I think, look at your podcast, the people that you're touching. This is our community coming together. And I really do believe we are going to be that pivot that changes the world.
Yeah, absolutely. We need to get away from this mentality of us versus them, or this is the only thing, and I'm not going to look outside of that. I see that in my practice as well. And even today, we had a few cases where I was able to figure out some issues for the patient, and I said I had to send them back to their doctor because at least here in Ireland, you need to go through your doctor to get referrals to certain places. And I had figured out something that they had not figured out. But instead of going, hey, that's great. What did you do to figure this out? Or how can we work together? They're like, nope, I'm not going to look at that because that didn't come from me, you know.
Yeah.
And this kind of situation. And sometimes we forget that the patient, whether that human or animal, is the one that we're working towards, and we should do what's in the best interest of the patient, right?
Period.
So
I mean, that's the end of the story
yeah,
is what is going to be best for that patient. And when we keep that mindset, it really changes how we behave.
yeah. So when you look in chronic disease in animals today, let's say skin conditions, arthritis, gut issues, you mentioned cancer. What patterns do you see that mirror what's happening in human health?
Well, 100% we're dealing with either deficiencies of essential nutrients. Those are the nutrients that the body needs to do its metabolic function. So deficiencies are huge. And then that's combined with toxicities. And the toxicities that we're able to actually test for include mycotoxins, heavy metals, glyphosate, and microplastics. I also do bioenergetic scanning, so I can see on an energetic level as well. But just those four are so informative because, to my knowledge, I'm the only one currently doing microplastic testing. I'm working with a lab they do people, but they've never done animals.
Yeah,
And we're finding that the average animal has more microplastics than the average human. So the average human, they say, is around 21 particles of plastic. The animals are in the high 30s, high 40s.
I
And
believe. Yeah, I
and this
believe that. Yeah,
Yeah,
yeah.
and people aren't aware of where these toxins are coming through. So I think that is the first thing that I help people to understand. And you make it simple. It's deficiency, toxicity, and some combination that leads to mitochondrial dysfunction. So now we can't make the energy that our bodies need because the mitochondria who do that can't function properly. And the mitochondria, a lot of people don't realize, are communicating with our microbiome. So all those organisms in and on us, there's this communication pathway that's happening. Well, when they're damaged, that communication isn't happening effectively. And so we have all of this dysfunction that starts to happen. And it's no wonder that we start to have symptoms. And fortunately, people are understanding because of their own health that inflammation caused by leaky gut and leaky membranes all through the body are what allow those leaky membranes are allowing things to come into the body that shouldn't. It triggers the liver to mount that inflammatory response. And instead of it being a good thing, it's, a one-time deal. You get rid of the invaders and you're back to normal, how it was designed. In today's modern world, that invasion is happening every minute of the day, every bite of every meal. And we don't do it intentionally to our pets. Pet parents love their animals, but
Hmm.
you know better, you do better. And so, we've been sold on this fast, cheap, and convenient Franken food that we've been told is balanced and healthy for our pets. And it's anything but that. So as the demand for healthier pet food comes out and people start to see the changes in their pet's health simply by changing the diet. sometimes that's just the first step. And it makes a big difference. We'll start to see a snowball effect. So the itching, the allergies, it's a different allergy pathway in animals, but the end result is that leaky gut leads to inflammation. That inflammation lands typically the first place in most dogs and cats are the ears. And what's the ear canal? It's skin wrapped up into a tube and stuck down a dark hole. So the first area, the first sign that we'll oftentimes see a problem is going to be ear infections. And then they become chronic. And then we start to see itching and skin problems and flakiness and hot spots. And then it just snowballs from there.
Yeah, yeah. So it's again, we're mirroring exactly what happens in humans there. And I think when you mentioned there being so many plastic and microplastics in the body, you just have to look at what a lot of people do with their dogs. What are most of the toys that they give to dogs? They're generally all kind of plastic based. Even these chewing bones and stuff, they're all plastic based. And even some of the dental things are all plastic based. And you're going, well, no wonder, because dogs are putting everything in their mouth, aren't they? So it's a direct vehicle in there. So yeah, I become really aware of that with our dog now. I'm just like me reading food for myself. I'm looking at the stuff. I can't give this to my dog. It's garbage,
But
and it's challenging. Yeah,
yes, it's awareness. But if we don't stop, I have people that they come in with boxes of supplements and then they go, is this good for my pet? And I have them just read the label. And when you read the label, you go, oh my gosh, I can't believe all that other stuff is in there. So I'm a DIY kind of girl. I love making my own stuff. I make my own for myself. I make my own butter, my own cheeses, my own condiments. I make my own seasonings. I live in a food forest. And it makes a big difference
yeah,
on how you feel and your health and your energy levels when you're not burdening. We don't live in a bubble. We're going to be exposed to toxins.
yeah,
But the more you can be in control, and the more you can limit the amount of toxins through your water, through your air. I'm big on air purification. I'm big on water purification. And those have to clean down to 1 micron. So if you have air filtration, find out what kind of filter is it and how do they prove that it goes down to 1 micron? And people are
mm,
pretty shocked to realize that their filtration water and or air doesn't do that.
yeah. It's I think a good question for the pet owners when they bring in, like you said, they're bringing in the boxes of toys and stuff they have. Um, I think saying, "Well, would you put that in your mouth and chew it?" Right? And I think a
Yeah.
lot of people would probably go, "Yeah, I'm not putting that in my mouth," right? So why would we give it to our animals?
Right, but they don't read the labels on a lot of pet food. That's changing. People are becoming more aware and they are starting to read more of the pet food labels. But I really do find that even the ones that are conscientious about themselves are not taking and applying those principles to their pet. I'm not sure why. It's not malicious for sure, but that awareness is coming around. And I think the pets and Mother Earth are part of the awakening process for us. It's a reflection for us to take control of what's happening around us. And it's just mirroring for us the level of toxicity in our environment.
Yeah, yeah, absolutely. The food. Yeah, the food. That's always been something since I've become a pet owner. When I got together with my partner, we never had dogs before, but then I was always questioning, well, why would you give this? Why would you give this to the dog or give that to the dog? And then what really threw my when I looked at the dog food and especially the stuff in the supermarkets, and you're going, so when do dogs eat oats or when do they eat corn or when do they eat broccoli and when do they eat alfalfa? And I'm like, come on, there's got to be
Yeah.
something wrong with this. And then you look at the lifespans of pets and all the conditions that they're having, and you're going, well, what's changed? Yes, we have more toxicity, but they didn't have that food 100 years ago. So, and what really floats my boat is when I love when I see vegan pet food and I'm like, yeah,
That's humanness trying to impose their belief system on nature.
yeah,
And I think the easiest way for your listeners to really be able to use their own critical thinking skills is if you have a question, find the solution in nature. What is the model that nature shows you? And that's going to be the one that is most sustainable. So dogs and cats are carnivores. We didn't create that. We didn't make it up. They are carnivores. In fact, cats are obligate carnivores. They have no dietary requirement for carbohydrates. Now, they got carbohydrates because they ate their whole prey. And if their prey was eating grasses and leaves and things like that, but they now become digested in the abdomen or in the intestinal tract of that prey, so that when the cat or dog is eating it, it's already digested, already fermented, already broken down, so that when they get it, they don't have to do the metabolic work.
Yeah.
Because dogs and cats do not have amylase in their saliva. This is the best argument. If nature intended for them to eat carbohydrates, they would have amylase in their saliva and they would chew their food thoroughly. Well, any of our pet owners know that not only do their animals not chew, they tear, gulp, and swallow. And then metabolically speaking, they don't have amylase in their saliva because they weren't designed to eat that way. If you're a predator and you just hunted something and killed it and wrestled and made a whole bunch of noise in the forest, you're going to attract other predators. And what are they going to be looking for? An easy meal. They're going to either eat your meal or they're going to eat you. So you have to tear, gulp, swallow stuff when food is available because you don't know when your next meal is coming. And then you go into your safe den and you digest. Well, in our modern world, they're not having to hunt. They walk over to the food bowl and it's always full. So they're eating constantly. They never have a fasting period. And it's a 40 to 60% carbohydrate diet if they're feeding some kind of a kibble or processed canned food. They
Yeah.
weren't designed to eat that way. And then all the enzymes in that food are going to be killed because it's all heated at high temperatures. So I had a meeting earlier this morning, and this client of mine refuses to feed her dog a raw diet for whatever reason. That's fine. However, this dog is only 2 years of age and is already having inflammatory bowel syndrome, multiple episodes in under 2 years of age. And now she's asking me, what's the problem? Well, you're feeding processed foods, and even what you're cooking is enzymatically dead. So this dog is using its pancreas to do all the digestion. It has all these chemicals and preservatives and sugar creating inflammation in the gut that was never designed to be there.
Mm,
And you wonder why this animal's inflamed and now having symptoms. It
yeah.
what do you want to do differently? You want to keep treating the symptom? It's only going to get worse. It's going to move from IBS, inflammatory bowel syndrome, to IBD, inflammatory bowel disease. And now it's a much bigger problem and it's a much more severe problem. And it's going to cost a lot more money and it's pain and aggravation to the whole entire family. So we just have to get out of our way. We have to ask the question, what is my real issue with feeding a species appropriate diet? And if you don't feel you can do it, maybe get a different animal, one that fits into your lifestyle and your belief system. If you want to feed an herbivore diet, get an herbivore. I don't know how to eat.
Yeah.
I'm not saying it meanly. It's just that we have to start using some common sense in our behavior and not trying to change nature in one generation.
Yeah, 100%. Yeah, I see that with my human patients as well, and I say, well, listen, just because a food is a natural food that's grown doesn't automatically mean that it's going to be good for you. And there's this kind of notion out there, well, it's natural, you can have as much as you want, and it's going to be fine. But if you don't have the process to digest and break it down, then it's going to cause issues. And anybody that's having gut issues, something you're eating is not working for you,
Mhm.
unless you have extreme amounts of emotional stress that which can, aggravate that as well. So, yeah. So, okay. So, mm,
Can I comment on what you
yeah,
just
of
said
course,
to
go for it. Yeah.
because when people are under a lot of stress, your pets are in training to those frequencies. So the average person who has a pet, they understand when they're really upset, that animal comes over and sits on their lap or takes the head and puts it under your hand, and then you start to pet and you start to feel better. They're in training to your energy. They're saying, here's my shoulder. I'll take some of that heavy third dimension energy and
Yeah.
I'm going to lighten it for you. I'm going to share so that you can start to feel better. And the point I want to make is that if you have a household where there's a lot of anger, a lot of frustration, a lot of chaos, a lot of kid issues, whatever, your pets are picking that up and they're going to have higher stress levels, higher cortisol levels, more inflammation, more leaky gut as a consequence. So you take inventory of where you guys are at and know that your pet's affected by that. On the flip side, when you start doing breath work morning and night and you start creating a calming environment and you start to get your household into a more parasympathetic state, your animal starts to relax as well because we are their pack leader. And when we are giving the signal that there is danger around the corner, they don't know where the danger's coming from. They're looking at the pack leader and saying, okay, I'm trusting you. You're giving me the signal that there is a saber-toothed tiger right around the next tree. And so I'm going to be on high alert and ready to respond. So they stay in high sympathetic tone, just like the people who are stuck in high sympathetic tone.
Yeah, absolutely. I see that in our household too. I seem to be the more calm person, and that's nothing against the rest of my family, but they are a little bit more on the anxious side. And I notice lately with the dog that the dog, when it's with the anxious people, it tends to be a little bit more hyper. And then when I come home, I get a wonderful greeting. And it's like, oh my God, thank God you're home so that you can create a bit of balance here. So it's really interesting when you see how the animals react to different people and situations. And
Yeah.
we all hear the story of, if an animal doesn't like somebody or is, not trusting them, that there's probably something off with their energy, and so you're 100% correct with that. Yes.
I just last weekend I had the privilege of going to the World Equestrian Center and watching some. It was like the World Cup Expo, all these high end professionals, and I'm reading every horse's body language, and I could tell you which horse was going to refuse a jump just from the way that they held their ears and their body language and the body
Yeah.
language of the rider, and I was accurate 100% of the time, and that the guy that ended up winning, he and that horse were so in sync. They I'm sure they were communicating on a more telepathic level because both of them were focused on their own job. And then they kind of worked together as a team and they were able to accomplish things that none of the other horses were able to do. It was really magnificent to watch.
Fantastic. So if I ever go betting on the horses, then I need to take you along, don't I?
Absolutely. Absolutely.
Right. Good stuff. So what do you think integrative veterinary medicine gets right that human medicine is only beginning to catch up on?
I think we have I'm not going to say that you actually are behind us because I've modeled everything I've done really after the human world.
Hmm.
Back when I started, there was nothing in the veterinary world. So I had to take everything that functional medicine was just starting at that time. And so I had to take everything I was learning on the functional medicine side and extrapolate that to the animals because there was nobody doing it.
Yeah.
So I don't think it's that we're missing. I think the difference is that what we are willing to do for our animals, we're not as willing to do for ourselves. So pet parents will do more for their pets to give them well-being, longevity, and quality of life in lieu of their own. They'll spend more money, they'll take the effort, they'll do the prep, whatever it takes so that that animal can live the longest, healthiest life, once they understand it, before they do it for themselves.
Yeah. Well, okay. And so then what would be the most common upstream drivers of chronic disease in pets that maybe are routinely missed in standard care?
100% it's deficiencies and toxicities and mitochondrial dysfunction. It's so simple, doc, that sometimes when I say it, I go, why aren't we all saying that? But we aren't trained that way. We are trained in allopathic medicine, human or veterinary, to name it, blame it, and then come up with a pharmaceutical. We were never taught to look at the root cause.
Hmm.
And now that I was taught how important it was to find the root cause and you fix the root problem, fix what's triggering it all, then everything upstream has a tendency to take care of itself. And that's not to say we're all going to live forever. We all have our lifespan, but these animals, our dogs and cats, should live into their 30s with vibrance, and they're barely making it into their teens.
Yeah.
Animals are living 7 years shorter than they did 25 years ago. That's a problem. I don't see that as moving in the right direction. So at least with what I'm trying to teach pet parents and the messages I'm trying to get out is that we have to take into account what our deficiencies and toxicities are. And here's a great example. Mycotoxins, when we have a lot of mycotoxins in the body, are very suppressive to the uptake of the minerals that we need to function.
Mm.
So even if those minerals are in your diet, if you have a lot of mycotoxins, it's suppressing their uptake. So when I'm testing for micronutrients and I see this down the row, they're all below the mean, I know there's going to be a problem with other toxins. And typically it's mycotoxins, and I think microplastics are playing a role as well.
Yeah. So I'm curious, it's probably going to be the same thing with animals. When you see an overload of toxicity in the system, are you seeing a lot of mineral deficiencies in animals as well?
Yep, that was what I had just commented
Yeah.
on. As
Yeah.
soon as I see that deficiency in minerals, I know there's something, it's either not in the diet or there's a problem in absorption.
Yeah.
And one other mineral that's very interesting, well, mineral, it's vitamin D. And we all know how important vitamin D is to all of us. Well, here's what's interesting. Carnivores only get vitamin D from their source of protein. Herbivores, the source of protein, only get it from the sun. We're omnivores, so we can synthesize vitamin D from both our diet and the sun. So carnivores who are eating a diet that the animal has never been out of a feedlot, it's never seen the light of day, or that food is being made from waste products and rendered foods, by a university study, 85% of dogs eating processed food are vitamin D insufficient. That's a huge number, considering that vitamin D, along with magnesium, run the entire innate immune system. If so, think about the fact that these poor animals are running around with no ability for their innate immune system, the one that we don't control and tell what to do, it can't function because it doesn't have the cofactors it needs to do its job. So is
Right.
it a surprise that these animals are not only sick, but that we can mask the symptom for a short period of time and then they either relapse with the same disease or something worse? So these are serious points. And then I think the other area, I'm going to open up a kettle of worms here. The other area that I think we are starting to really have a hard look at are the sex hormones, because we're neutering and spaying these animals under 4 months of age. And we're stripping them of all their sex hormones, which have a lot of positive impact on the body, not just for breeding sake. And when we take that entire pathway out, we're not suppressing the feedback mechanism and we're having an egregious amount of dis-ease that is related to this lack of adequate hormones.
So, in that line, why do we hear so much from veterinarians that, well, the best thing to do is spade or neuter your animal because you're going to reduce the cancer risk? I hear that all the time. And I always wondered, does this really actually make sense?
Thank you.
Yeah.
It doesn't make sense, but
Yeah.
it's sort of like the Crisco scenario and eating lard and sugar and avocados and healthy saturated fats are bad for you. All of these wives' tales are started, and we accept them because if you keep telling a lie long enough, people believe you. And whether it was started for the right reasons or not, was there ill intent, was there maliciousness? I don't know. I think that spay and neuter has some relevance, but not the way we're doing it.
Hmm.
Could it help with population control and some of the behavioral problems? Yes. But the idea of taking away all the sex hormones is deleterious. And we're actually seeing that cancer rates actually are going up. So I think there needs to be a reevaluation, but this is going to be a slippery slope because having intact male and female animals has another whole set of issues. Even when we do like an ovary sparing, where we leave the ovaries and we take away the uterus so that they still are making their sex hormones, there's still some behavior things that parents are going to have to contend with.
Hmm.
And there's where education and understanding come into play. But we're going to have to make some changes. We have to start using that critical thinking skill and saying, are we doing the right thing the right way? Or could we have a better way of doing it where we can be on the double edge of that sword and still help the animal and still control some of the population issues? And that's just talking strictly about sex hormones. But talking about diet, I mean, gosh, look at the food industry. Mars, I don't know if you have Mars in Ireland, but
We do.
Mars, okay, well, they're worldwide.
Yeah.
They own over 30% of the veterinary industry, from food to pharmaceuticals to laboratories to referral centers, veterinary hospitals. It's huge. And I'm not saying anything negative about Mars. I'm just saying if you look at their product lines, they're really not designed for health. So, how can we merge our worlds? I think without a doubt, we see that we're heading in a very bad direction. Wouldn't there be a wonderful option where we could join forces and start to make some shifts so that we all can get the best? I mean, they're already in production, they're already doing so many things in the world. What if they could just do it a little healthier? What if they could make their business model one that actually supports health and longevity? Wouldn't that be amazing? So that's my focus. I'm not trying to badmouth anybody. I'm saying let's all pause, take a deep breath, look at what we're doing. And is what we're doing actually supporting the pet body, the human body, and Mother Earth? Or are we creating the demise? Because at the end of the day, Doc, if we destroy Mother Earth, we don't have a planet to live on. We're doomed anyway. So, what would it hurt if we take a step back and we start to make some of those more sustainable changes?
Yeah. 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 I agree with you 100% on that. I think we need to, in this fast paced society, sometimes maybe we forget to think think and ask questions. And one of the things I always ask, does this make sense, or how will this benefit me or my patient or my pet? And if it doesn't make sense or it doesn't, then, well, why the heck am I doing it in the first place?
Beautiful question. And the other thing, now we're getting a little more esoterical, but I think that a majority of people have become very disconnected from their planet in
Mm.
a very conscious way. Like we really are disconnected. Kids don't know where their food comes from. They don't spend time outside. They're just stuck looking at screens and sitting inside homes, and the air quality inside most people's home is way worse than the air quality outside. And we're not moving. We're not living. We're just occupying our brains and being distracted. So, what if, as a society, parents started to integrate things with their children, like making meals together, learning how to make butter and cheeses, and learning how to cook, and growing some herbs, and at night making a tea from the herbs that you grew? It doesn't have to be humongous changes. You don't have to redo your entire lifestyle, but start making one or two conscientious changes. And then once that becomes who you are, pick a couple more things that you want to start to incorporate. So I have a column A, column B is my system. Column A, all the things that I'm teaching my pet parents that they should be doing, but they may not be doing them yet. So I have them write it all down. And then column B are all the things they should not be doing, cut dry, end of story, but they're still doing it. Once you write it down, then you have a roadmap, and you go to column A, you pick one thing that you want to start doing, and you just make it who you are. It becomes part of your life. You don't have to think about it anymore. And then you look at column B and you pick one thing that you need to stop. So every person who is listening to this podcast is probably listening to other health conscious podcasts. Write these things down. Do it in your phone, wherever, but just keep a list of the things that you should be doing and a list of the things you shouldn't be doing, and then start making one change a week. And before you know it, you've made massive improvements to your health, your pet's health, planet Earth. It's just so rewarding and you feel so good about your life afterwards. You have more energy, you have more brain working, you have less fog. It's I can't say enough. And I'm rounding 70. So
Uh,
I'm telling you, I am living this principle. And I look at my friends that are my age and they are bags of medication and they have no energy and they're in brain fog and they don't feel good. And I am vibrant, thank God, every day.
well,
So,
you're doing fantastic for your age, and it's always a great compliment. I get that as well when people think I'm 15 years younger than I am, and things like that. So, and it's
yeah,
always and I look at other people, and I'm sure you do the same that are of the same age and that, and you're going, well. Why is my health? Why do I look so much differently than they do? Or sometimes they ask me that, and I'm going, well, that's a good question, is it? So, what are you doing? You just mentioned those habits. We all have bad habits, some a lot more than others. Well, how did those habits happen? It just happened through repetition, repetition, repetition.
yeah,
So if we can do bad habits, we can do the same with good habits through
yes.
proper repetition, and making your list like the way you're doing is a great way. And you redo that. And then, most things after 21 to 30 days, it starts to become ingrained and we have a habit and then it sticks, hopefully. Yes.
Yeah. And it's so much fun doing the things that our ancestors did. They had to do it. They didn't have an option. But it's so much fun to really participate in your health and to do the things that at the end you just there's an energy, a feeling of well-being and happiness, joy. We know that the highest vibration of energy is gratitude. So look at all the different religions and practices where before you eat, you give a prayer of gratitude, either before and or after. That's not an accident, right? That's
Mm,
putting your body into a state of energetic parasympathetic perfection. So when I'm making things, I'm enjoy. I won't turn my camera around, but I've got all kinds of fermented foods going and
yeah.
sodas that are all from fermented, the way that I use to make my yogurt and my cheeses and everything gets recycled on the property. I don't have almost nothing in plastic. Sometimes you just don't have a choice, but it's
Yeah.
very, very minimal. We use silicon and glass and stainless steel, and it's a conscious way of living. But it's now to me, I don't even think twice about it. It's just who I am.
Yeah, yeah, fantastic. Yeah, and like we said, we need to make sure if we apply those principles to us, why are our pets any different, right? Especially now that animals are really parts of the family, and I think a lot of people not everybody. I think a lot of people respect their pets, but then there are some they're just like, leave me alone or give me the scraps and so forth. And yeah, we have to be careful of that. Um,
I know there's still the pet parent out there that they don't consider that they own a dog, and I know they're out there, but at least in the world that I attract, we create our own little hologram. In my hologram, I have pet parents who that is their child. That
yeah.
they are highly connected to the family and they will, like I said earlier, they will do that they need to do in order to keep that pet healthy, which ultimately will make it better for themselves as well because you clean up the environment for the pet, you're living in that same environment.
Yeah.
So it does come around and it helps everybody.
Yeah, yeah, absolutely. Yeah. Okay, so we've talked about different things like cleaning up our environment and nutrition and positive behavior, but you've also worked extensively with other therapies like ozone therapy, photodynamic therapy, bioregulatory approaches. So how do you decide when these tools are appropriate and when they're not?
That's a great question. Um, History, physical exam, I test, I don't guess. So I really know what's happening inside that pet's body. And what these different therapies do is they actually stimulate or help in detoxification, the very bio the very biology of the body. So when I'm looking at a treatment, I'm looking at how can I turn on that biological pathway that is needed for cancer resolution or anti-cancer effects or to produce energy. So each of the things that I do are either to help the body in detoxification. There's 6 organs of elimination. I'll say them for the audience. We have the kidney, the colon, the lungs, the liver, the skin, and the lymphatics. I like to now incorporate lymphatics with our fascia since we know how important the fascia is. So lymphatic fascia are kind of they're separate systems, but the
Yeah.
lymphatic runs through the fascia. So we need to address both of them. So that's the first thing I do is I test for deficiencies and toxicities and mitochondrial dysfunction. Then I look at the organs of elimination and I assess how well or not are they working. And then I support the organs of elimination. And then I start to support the other biological pathways that are more specialty. But I've already addressed the environment, looking for the first thing we have to do is stop doing the things that are causing disease. Like it's so basic, but
Yeah.
you can't keep polluting the stream and expect to clean it up, right? You got to tell the people upstream, quit throwing pollution in the stream because you're trying to clean it up. So we got to look at the food that we're feeding, make sure it's species appropriate, the water that we're drinking, properly structured, filtered. And then we need to have the proper level of air quality in our homes. We need to look at the amount of electromagnetic frequencies that we're exposed to and be able to mitigate that, both the electricity coming into the house and the EMF that's being produced in the house. And then environmentally, what's touching our skin, and not the least of which is our thoughts. They're the ants that live in our brain. ANT is automatic negative thoughts.
Mhm.
And we touched on it earlier when we said whatever the energy that you have in your household, your pets are going to entrain to that. So becoming aware of how much negative thought you may be having. And it's not that it's a bad thing, it's there to remind you what you're trying to heal or transmute. So once you become conscious of a pattern of thought, you can actually change it and do something different. So step number 1, we get rid of as many of the environmental and lifestyle factors as we possibly can. Then we have a species appropriate diet. We make sure all the essential nutrients are provided. We heal the leaky gut. Then we do the detoxification. And then we look at mitochondrial health. And when you put it together that way, it's broken down into a plan of action. And I actually have a free ebook that everybody's welcome to download. I think it's holistichealingvet.com worldwide. And it gives you those 6 steps and it's broken down for you so that you can incorporate that into your lifestyle. And it's really very easy. It's just a methodical way. We're not throwing spaghetti on the wall. We're not following the dangly object on the social media where it says, oh, product A does all of these wonderful things. Well, yeah, it might, but if you don't set the foundation for the body to be able to function, then that dangly object isn't really going to make an impact. We have to create the epigenetics, the lifestyle that allows the body to function properly. So, to answer your question, that was a long way around it. Ozone I use for almost everything. The body makes ozone. The mitochondria literally make ozone in our body. It's a redox signaling molecule when it makes energy. So now we're just taking and we're adding a prooxidant or a oxidative stress appropriately so that the body can start to reduce inflammation. Ozone turns on over 200 anti-inflammatory pathways. It is such a magnificent tool. Easy to do. Pet parents can do it at home with proper teaching. We teach people, we get them set up with the right equipment. Hyperbaric oxygen. Again, we now have technologies that pet parents can afford to do this in their home. And it's not just for the pet, right? Because you put the pet in the hyperbaric chamber, but you get in there with your pet. And
Yeah.
now you're enhancing the ability of oxygen to go into tissues deeper because we're not breathing properly and we're not moving properly. So these are, I don't like to use the word biohacking, but they are ways for us to do what nature intended for us to do, but we've created a lifestyle where we don't do it. We don't do high intensity exercise naturally. Our pets aren't getting to do high intensity exercise, but they need to. So these are ways to help simulate that. And then my other really favorite tool is doing light therapy. and I have a particular laser that can be used intravenously. So there's a fiber optic that goes in through an intravenous catheter. We can use it rectally, we can use it intralesional as well. But intravenously, we can introduce the spectrum from ultraviolet to blue, yellow, green, red, and infrared. Red and infrared do penetrate the skin, but those lower light frequencies can't penetrate through the skin. The melanocytes, dark pigments, they absorb those frequencies, so they never really get into the body. But when you do it intravenously, now you can take that light and put it right into the bloodstream, and the red blood cells pick up that light and carry it around the body, delivering it where it needs. And that helps to produce more energy. It stimulates the mitochondria. We can use it as a targeted cancer therapy because that light can carry photoactivators, products that we can give, botanical products that we can give either orally or intravenously. That goes into the system, and then we add the light that activates that particular product, and it carries it right into a lesion where the circulation is already there. It accumulates, and that light activates the product that we gave. As example, curcumin. We all know what turmeric is, but we can actually give curcumin intravenously, and then we activate it with blue light. And that spectrum of blue light takes the curcumin, it makes it really active, much more active than it is on its own. And it creates what are called reactive oxygen species that will selectively kill the abnormal cells, but spare the healthy cells. So it's very targeted therapies. So to answer your question, I picked the tool that would be most appropriate to get the effect that I'm looking for that particular animal.
Yeah, that's fantastic. It's nice to see that we kind of get away from these mechanical, not that they're not important, but the mechanical and kind of biomechanical processes in the body. Not that that's the be all and end all. We get into more of what we call quantum biology. So
Yeah.
looking things on an energetic point of view. And for some, they get it. And for others, this is all new concepts and it's not the hairy fairy tree hugging hippie stuff anymore. This is reality. There's validated scientific studies on it, and they're absolutely fascinating. And the great thing about it is, most of it is free. It's uh, it's just get out there, and in this fast-paced society, we're not getting out there as much as we should. And then some of these extra devices, they can be useful. I have a red light therapy room in my clinic, and geez, I can tell you, especially in Ireland where we don't get a lot of sun, I'm in there almost every day, getting my dose of light, and I don't think I would be happy and chipper if I if I didn't have that. Yeah, you know.
Well, you're right. You know, I live in Florida, so we are literally, even in the winter time, we have beautiful sunlight. Is that the ideal? Yes. Go out in the sun. You're getting the entire spectrum if you're out in the sun sometime in the morning, midday, and right before dark. So that's a great thing to do, but a lot of people don't have that option. I mean, even I sometimes I get up before the sun comes up and I'm at work, and then I don't get home until dark and I don't have time to go outside during the day. So we all have our dilemmas, but that's where we can take things like red light therapy or using photodynamic therapy or low level light therapy in a way that you're just simply simulating what the body needs to have, and you're just providing it in an opportunity where it may otherwise not have had the ability to function.
Yeah, yeah, absolutely. Yeah, that's fantastic. Yeah, and even what you were saying before about absorbing nutrients and how light can affect the absorption of that, and then if not, then you have to have more of the food sources that have it in, where you said that the animals convert that. So in Ireland, geez, we have great beef in Ireland here and lamb and that, and it's all out in the open. It's all eating grass and the likes like that, and that does the conversion, and we eat that. Benefits me, benefits my dog as well. The dog, when it gets raw meat, it's the happiest. It's there waiting. Hey, give me some of that. You know. Yeah.
Absolutely.
Yeah, yeah. So yeah, that's fantastic. Um, there's when we talked about detoxification in pets and toxicity that exposed to, have you seen things where, let's say, the animals almost act like an early warning system for various toxins or household exposures and things like that? And if so, what would be the biggest stressors that you're seeing?
Absolutely. We lovingly say they're the canary in the minefield.
Yeah.
You know, back in the days where we had miners, they would put little canaries down there. And if the bird died, you knew the air quality was bad. And so it gave warning to the things that you can't see or smell or taste. And the animals are the same way. So I think now that we're doing the extensive testing that we are, and I say we as me, because I'm the only one testing for microplastics in animals. And there are a portion of veterinarians that are now looking at doing mycotoxins, but very, very few. Even integrative veterinarians are not knowing what does that really mean to be
Mm,
integrative. They're still doing the allopathic name it, blame it, but now instead of using a antibiotic or a steroid, they're using an herb or an acupuncture needle, but they're still doing symptom suppression. So I hope to educate this population who does want to do something different and help them to learn that when we understand the biology of the body and we treat the biology, the root cause, we find out what's actually causing the problem, then we have a toolkit that allows us to actually fix that problem, whether it's a Western issue or a Eastern solve, whatever that is, pick the tool that you have that is most effective, cost effective, and also accessible to you.
yeah.
So I think when we create this mindset of how do we create a sustainable lifestyle, we start to come up with better solutions. And I think it really just comes down to understanding that if you don't have a solution, it just simply means your toolkit isn't big enough. And you need to look outside of the limitations of both what you have accessible to you and what your mind can perceive so that you have the ability to get more solutions. As soon as we ask that question, what else can I do? You're putting a receiver out. Now you just have to wait for the answer to come in. And as long as you authentically put it out there, that answer will come back. It could be in the words of a song. It could be the next person who's sitting next to you at a table. It could be some serendipitous introduction, but the answers do come. We just have to be paying more attention.
Yeah, 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 absolutely. Yeah, absolutely. So when we're affected by stress a lot, in humans, there's a big stress physiology there, and obviously animals experience stress as well. So, how does chronic stress usually show up physically in pets? If somebody was wanting to know if their pet is stressed out, what would they be looking for? What would the signs be?
They're not always going to show the emotional changes that we do, and they don't complain because they are in the moment. That's one of the
Yeah.
things that we need to learn from our pets is that they live in the moment. There's no real past and there's no future to them. They're just happy right now. And that's a good lesson that we should have.
Mm,
So stress could look like vomiting, diarrhea, allergies, itching, because stress releases cortisol. Cortisol breaks down the tight junctions. So anything that creates leaky gut, and stress is a huge factor there, and that could be emotional stress, it could be physical stress, it could be EMF stress. There's a lot of stressors, toxin stress that's going to lead to inflammation. So anything that is a sign of itis that could be in the gut, in the skin, in the eyes. We see a lot of elderly dogs that get lenticular sclerosis. The pupil becomes kind of blue.
yeah.
And so you look in your dog's eye and it has that blue haziness. That's inflammation. Periodontal disease. Great example. Open the dog's lips and look at their teeth. Is there a bunch of smell and tartar and nasty in there? That's all inflammation that happened to go to the weakest link in that pet. One of the biggest ones is osteoarthritis.
Mm,
Cancer, of course, but osteoarthritis is one of the big indicators. Now, when I started practicing 40 years ago, 41 years ago, we would see a lot of hip dysplasia in our
mhm.
larger breed dogs. I very rarely see hip dysplasia, but we have animals with spinal problems. They have spondylosis or fusing of the spine, arthritis in the spine under the age of 1.
Mm.
So we're seeing degenerative disc disease, all these structural problems. Now, is it related to the early spay and neuter that we discussed, to the amount of inflammation coming in from processed foods, from the lack of nutrition, from so many different factors? But ultimately, that inflammation will go to the weakest link or links in that pet's body. And I just listed a half a dozen things, but look at obesity, look at autoimmune diseases. There's so many things. Everything is related to inflammation. That's your underpinning, is inflammation.
Yeah, yeah. And inflammation is reactive. So you have to figure, what are we reacting to, right?
Yes. Instead of just let me suppress it with a steroid or a non-steroidal anti-inflammatory, that's not solving anything. We need to fix the root cause.
Yeah. Yeah. I have a couple more questions and I'm going to let you go. I want to respect your time here, but you mentioned you've been in practice for 41 years. So looking back over those 4 decades of practice, what do you really think? What's a true healing driver, regardless of modality? What's the one thing that moves the marker and moves the needle the most?
Intention.
Tension.
Yeah, it's the intention that we move forward in the world. We all are going to make mistakes. This is Earth School for a reason. And we're here to learn, to grow, to be the conscious edge of creation, and meeting each other where we're at. And then learning that we can work together. We do not have to have a competition with the world around us. We want to have a cooperative world where we can all enjoy our differences. We can celebrate our uniqueness, whether it's in personal relationships or business, religion, it doesn't matter. How can we ultimately work towards the same goal, which is a healthier planet and healthier people? And that's health in the physical body, in the mental body. Gosh, after COVID, we just saw our mental health just plummeted. I've never seen so much unhappiness in people. We can do something about that. I think as we support each other and we show kindness and compassion and we pay attention to the little things that matter in life, and we reconnect to ourselves, to our pets, to our friends and our family, and to strangers, and ultimately Mother Earth. I know I probably come back to Mother Earth a half a dozen times in this conversation because we're not disconnected from it. We only have the perception that we're disconnected, but we all are one energetic energy that's influencing each other. And when we start to have that level of respect, that respect yourself and respect everything around you, that's what I've learned in my 41 years is we are a cooperative community and we need to play our part.
Yeah, yeah. Well, yeah, well said. I can't even add anything to that. That's perfect. Yeah. So maybe in closing, if there's one message you'd want pet parents and practitioners to walk away from after this conversation, what would that be?
Become educated. It's so simple, is learn. Never stop learning, never stop improving. So when we know better, we do better, and don't get stuck looking back at what you did wrong. Look forward as to what can you do right, because there's no coincidence between who you are, where you are, the pet that you have at the time in the life that you have that pet, and what those pets' challenges are. It's all part of our little hologram that's supporting us to be the passion and the purposeful person that we came here to be. And when we step into that power, it is the most magnificent experience on planet Earth. And everybody has that opportunity to do that. There's nobody insignificant. We all are part of the spectrum that make this place the beautiful, magnificent place that it is. And when we can look around and appreciate the complexity and the uniqueness that we are able to enjoy, everything from the wind, the rain, the sun, the darkness, the cold, everything is so magical. And we just need to put our childhood eyeglasses on and experience it through the lens of a child with wonderment and joy and gratitude. And even if you only do it for 5 minutes a day, start with that. Look outside your window and just see it through the eyes of a child. And then that grows from there. Then you do it a little bit more and more, and you do it in different situations, and you look at strangers and you just think, wow, how are we connected? How are we more alike than we are different? And when we start finding the things that we resonate together, we will have a much happier world.
Absolutely. That's fantastic. And I really appreciate what you said and the work that you do. We truly need more practitioners around the world that have this type of opinion. And if we're not shifting that energy, we're not shifting anything. So we really need to up the vibrations, the frequencies all around. And everybody, humans, pets, we will all benefit from that. So thank you very much. This has really been a fascinating conversation. In closing, where can people learn more about your work and what you do, maybe some of the courses and books that you have?
Thank you. It's so simple. DR, like in doctor, and then my name. So drmarlenesiegel.com. And that is the hub of everything me. So my pet parent courses are there. My veterinary training courses are there. Our online store is there. Lots of free resources and blogs and articles and videos. And just everything is at drmarlenesiegel.com. So that's the easiest way to connect.
Perfect. And we'll put that all in the show notes. And that's for just because Dr. Siegel is in Florida doesn't mean that you can't benefit from her work there. Actually, I do have a good following in Florida, so I'm sure we'll send them your way there. But
Thank you.
in Ireland, Ireland is a very pet-friendly place. Lots of cats, dogs, horses, and the like. So I'm sure there'll be a lot of people that will look to your information there. So again, thank you very much, and I'm going to wish you a wonderful day. And thank you for being on the Integrative Continuum. And for everybody else, thank you again for joining. And if there are any people that have pets that would benefit from this, definitely send it their way. This info that we had today is not only good for your pets, it's good for us. We learned that where we react with the same, the same facets of health and well-being affect us all in equally the same ways. So again, thank you very much. And everybody have a great day, and we'll see you next time. Take care. Thank you for joining me on the Integrative Continuum. I hope today's conversation gave you new insights and practical tools for your own health journey. If you enjoyed this episode, please subscribe, share it with someone who would benefit, and leave us a review. It helps us spread this message further. Until next time, I'm Dr. Richard Rocker. Stay curious, stay empowered, and keep moving forward on your path to integrative health.